The MSK Symposium that we're hosting as a division in conjunction with Bach and Garrison is aimed at primary care providers, specifically physicians and PAs, to help them improve their musculoskeletal examination procedures, understand injury trends that we have here on Fort Campbell, and also to improve the readiness of our division and our other Garrison units.
So musculoskeletal injuries are the #1 reason that negatively affects soldier readiness. And the Musculoskeletal Symposium provides an opportunity for us to showcase how primary care providers can get soldiers the treatment they need to return to duty as soon as possible.
The big benefit that I've been getting so far is communication between departments, knowing what's available at physical therapy, knowing what's available in pain management and orthopedics, and who to consult and how to best facilitate care for our soldiers and make sure that it's timely so that we can get them back to readiness as soon as possible. It's really great, especially for providers that are working out in FORSCOM units and not in the hospital, because you sort of end up in your own world sometimes, so it's good to come back together as a community and really learn what's out there.
Without great communication, we really miss opportunities to collaborate and improve care and readiness of our soldiers. We, as the division provider team, work with Bach hand in hand on lots of different products, but this particular product really gives us face time where we can really collaborate with our provider teams from both sides.
From the first day, we did neck and shoulders and back, and from an occupational therapy standpoint, some of the back stuff does pertain to upper extremity injuries, but the neck and the shoulder was really interesting for me as an occupational therapist. But the OT level, when we're dealing with elbow, wrist, and hand injuries, and if there's a neural component, it was really educational for me to learn from the PA and the ortho surgeon about clearing the neck from a neural side versus a distal neuropathy.
The impact of us being here, I would say #1 is just improving streamlined care for our soldiers. So if you've got a lot of soldiers that are getting lots of musculoskeletal issues, it's really good to be able to recognize, quickly diagnose their problems, quickly know the best outlet for them. Because the faster you know how to recognize this stuff and use all the resources that we have available here in the hospital, the faster that they get back to readiness, which is our #1 priority.
Primary impact for this symposium is aimed at soldiers within FORSCOM and improving their readiness. We do utilize provider teams from both Bach and from the division to augment that. What we're looking at is making MRDP decisions faster, returning soldiers to their duty faster, and then also dispositioning them in whatever direction is best for the soldier and for the Army at the same time.
Readiness to me means your ability to deploy as a soldier, your job primarily as a soldier, and for me to be able to get you back to that is important.